3 years ago, we came up with the idea that primary care clinicians were being denied the ability to deliver effective lifestyle interventions for a lack of knowledge, that they didn't have a framework that they could utilize to deliver a relatively consistent delivery of care and then track their outcomes. So we developed with Dr. Chatterjee and Dr. Panja, we developed a strategy that allows them to collect information utilizing their existing skill sets and information, and then translate that using simple, safe, well-evidenced strategies to produce a lifestyle prescription, which typically contains maybe 3 or possibly 4 recommendations, which are then measured and monitored by feedback from the patient, and that information is then retained and stored in the individual clinician's records. Now, we know, having done this for quite some time and trained now over 1,000 GPs, that the anecdotal feedback is extremely impressive. They get a lot of success, they feel more empowered doing their work, and more importantly, the patient's feedback to them, and indeed to us, through various mediums, is that they've been infused and excited to discover that there's a different way of treating problems for which they could find no successful intervention. There's been a significant change in the type of patient that presents to primary care over the last 20 years. It's dominated now by people with what's known as non-communicable diseases. These are often nebulous, difficult to describe, but tend to include things such as problems with their joints, their gastrointestinal tract, concentration, sometimes autoimmune conditions, skin complaints, for which there isn't really a protocol set up within NICE guidelines or typical clinical guidelines, and both the GP and the patient become frustrated because there isn't a clear pathway to facilitating that person to recover. They may end up becoming a polypharmacy by having 3 or 4 different types of medications which produce their own risks and problems. So what we aim to try and do was to break that process down by asking a series of very sensible, easy to follow questions that allows a relationship between the patient and the GP to be formed, so that they become a partnership in trying to unravel commonly known but often poorly described processes that trigger both inflammation, oxidation, and immune dysfunction. And when you wind those back by simple, safe interventions, many of these nebulous symptoms begin to either diminish or disappear altogether. And that empowers both the physician and the patient to engage in further interactions to take better control of their own healthcare. And both parties come out feeling a lot happier and enjoying life much more. We've had an enormous amount of interest for this last course. It's the 5th one that we've run. Currently, we're going to be suspending live presentations whilst we work with an organisation to deliver what we've done in a single masterclass for a series of online educational programs. That doesn't mean we're going to disappear, quite the contrary. We're likely to come back with a slightly revised format, maybe a 1-day or a 2-day conference in which we'll pull together all that we've been teaching plus some additional information. But to really scale this, to make sure that every single GP in the country can have access to this sort of training, we need to go digital. So later this year, we hope to be in a position to be able to announce that, so keep watching.